I'm welcoming you on behalf of the Museum of Medicine and Health. What is our museum? Our museum is not a grand big building, as you might expect. Usually museums, we associate big buildings with it. Our museum is a room full of stuff in the medical school building. It's a lot of objects, a collection of objects that were associated with medical research at some point and with teaching medical students in our medical school. So we have these objects, we preserve them. We have a little exhibition in the medical school building, but what we do very frequently is invite pupils like you and lots of people from around the community to look at our objects, to handle them, to see how they work, how they feel, how you can touch them, what you can do with them. This is what we would usually do. Unfortunately, this year we can't, but we hope that this is going to be equally exciting to have a virtual event. What we have here today is two young researchers who work at the university, both doing research on projects about and around hearing and hearing loss. And I'm going to introduce them both very, very briefly now, and they then are both going to talk about their research. Our first speaker is Catherine Conroy, and you can see Catherine, she is up there waving. She's up there for me. I don't know where she is on your screen. Catherine is a ENT doctor. Who knows what ENT stands for? Put your answers into the, knows what ENT is? I'm sure you do, but I'll explain it anyway. The E is for ear, the N is for nose, and the T is for throat. And Catherine is training to be an ENT surgeon, but she's also been working for quite a while. But at the moment, and that's important for today's talk, she's doing a small research project as part of her master's degree on the history of a technology developed to help people with hearing loss to regain hearing, to maintain hearing. And she's doing her project on the history of hearing loss technologies, and she's going to talk about that. And she's also going to talk about the history of education for deaf children. So it's a short historical introduction she's going to give us. And the second speaker who's going to speak after Catherine is Dr. Dalia Zimpida, who originally studied psychology, but she's not going to talk about psychology today, because since then she's become a researcher, and her research project was on the epidemiology of hearing loss. And this is another question. What is epidemiology? Anybody knows what epidemiology is? What's in there? The term epidemics is in there. So originally, epidemiology was the science of epidemics. But now epidemiology is much broader. It's the study of how a phenomenon like hearing loss, for example, and that's what Dalia has been studying, is distributed in the whole population. What do we want to find out? We want to find out who gets hearing loss. Do everybody who gets hearing loss live in the same place, for example? Do they work in certain professions? And that's what Dalia has been studying, and she's going to tell us more about that. So that's what epidemiology is. Why do we want to know this? Because if we understand it, we can manage it better. We can even prevent it, perhaps. And that's the purpose of Dalia's research. So I think that's all I need to tell you, because both Catherine and Dalia are going to introduce your research. So I'm going to hand over first to Catherine, who's going to tell us about the history, and then we'll join forces again, and then Dalia will be talking about her research, and then afterwards we'll have a chance to ask questions and discuss what they've told us about. Is that okay? Then over to you, Catherine.